It's time for the Medical Minute, brought to you by Altru Health System.
Stroke is the third leading cause of death in the United States. Today, Dr. Matthew Roller is here to discuss the many signs and symptoms of stroke. Hi, Dr. Roller. What causes a stroke and what are the common symptoms?
A stroke is caused by a lack of blood flow to a certain part of the brain, usually caused by either a blood clot that arose within that vessel or a blood clot that came from somewhere else, either from an artery or from perhaps the heart. The symptoms of stroke depend upon which part of the brain is involved. It can include confusion, dysfunction with one side of the brain, problems with speaking, or weakness about the face are some examples of symptoms.
Who is considered high risk for having a stroke and what can be done to reduce the risk?
Patients with the highest risk of stroke include the elderly. The older a patient is, the higher their risk of stroke. But other vascular stroke risk factors include patients with diabetes, high blood pressure, elevated cholesterol levels, and certain heart conditions. These risk factors can generally be managed with medications, blood pressure medications, the control of sugars and diabetes, and cholesterol medications.
What should be done if you suspect someone of having a stroke?
A stroke is a medical emergency that requires emergent evaluation and management and treatment. If someone is suspected of having a stroke, 911 should be called and the patient should be brought to the emergency room as soon as possible.
Thanks, Dr. Roller. For more information, visit altru.org.